Hello, everybody. I was taking notes on this paper that I've been waiting for a while from Dr. Brad. Matt Caberline is also on here, looking at rapamycin and how it affects functional improvements or with weightlifting in older adults. So it finally has arrived. I have lots of friends taking rapamycin, and I've been curious. I did have the concern that this paper found was that rapamycin actually suppressed functional improvement in adults with weightlifting. It was only a 12-week study, but let's take a look. I was taking some notes on this. I figured I should just make a video. It'd be faster. So the conclusion was 6 milligrams per week did not enhance functional improvements. Actually, the exercise did much better. Well, no, it did enhance it, but it didn't do it greater than the placebo group. So this is a double-blind, placebo-controlled study. And they did pretty good. You could always do it for longer, but these trials are very hard. We were doing a rapamycin trial in 15 patients. It's very expensive. It's very time-consuming to do a trial, so they did a pretty good job overall. Let's just kind of go through this. So as you get older, muscle mass strength disappears. I'll discuss the difference between those. And so people get old, they fall, they get more frail. This is not great for aging. So the concern I had, and what this paper likely shows, is that a single large dose of rapamycin abolishes the post-exercise rise in muscle protein synthesis in young men. So that's kind of the idea. Is mTOR helps you build muscle, helps your body fold these proteins. The problem with mTOR, theoretically, is as you get older, it might become more active. My theory, at least, is that as you age, your body misfolds the proteins, and so as a result, or as a treatment method, you could tamp down this system so it doesn't go into like higher mode where it's always trying to refold these misfolded proteins. Potentially, that's my theory. But there was some interesting rodent data. So as you can see, preclinical data was conflicting, which is normally how data is if it's been investigated enough. So although high doses blunt adaptations, low doses may often spare or enhance functional outcomes in mice. So they found increased muscle mass in mice and in women. We'll talk about the Pearl study. And downregulating senescence, blah, 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 etc. So they set out to test this because people are taking rapamycin to live longer. And the question is, does it help improve function? So we're going to keep moving here. Next section that I found interesting was they didn't measure the pharmacodynamics in this trial, but previous studies have looked at this. So 5 to 6 weeks actually inhibited S6K1 phosphorylation. I don't quite know what that is, some type of phosphorylation, for 5 to 7 days, whereas mTOR2 remained unaffected. So let's see here. So there's mTORC1 and there's mTORC2. These are part of the mTOR pathway. So it appears that this is blocking just mTORC1, mTORC2. So I believe they're saying that's why they thought it may be beneficial for this. So early human studies show the intermittent silence is feasible. Yep. So it appears to be safe and well tolerated in humans. We've seen this. And our study was kind of showing something similar, even though it didn't finish. Low dose. Yep. It appeared to be safe, and it did increase lean tissue, as you can see right here, and reduced pain without adverse metabolic. Now, this was the Pearl study. We can talk about this. Essentially, what I found is that only in females that were taking 10 milligrams a week did it improve lean tissue. And I looked into this a little bit. I was trying to figure out why this would happen in just women, not men. And I didn't see it actually when I originally read this paper. It was when I was reading the Pearl paper that I saw reduced pain. So the women reported that they had reduced pain during rapamycin. I came across a paper a while ago that found that walking in women actually increases lean tissue, but it doesn't in men. And so this is kind of a jump, but potentially the reason why we saw this lean mass increase was that if women had reduced pain, maybe they walked a little bit more. For whatever reason, it doesn't appear that walking is enough stimulus for men to build lean mass, but it is enough for women to build lean mass. So that's my current theory, is that maybe it wasn't the rapamycin that caused this. Maybe it was the reduced pain, which then improved walking. So that's an aside. But nobody's ever looked at rapamycin, as I say here, with at-home exercise to see if it helps or optimizes these performances, which could be good because in theory, what you want is you want mTOR on when you need to recover and build, right? And on and off is kind of loosely used here, but just think about it for a second. So mTOR, if it's always on, it's chronically elevated. This isn't going to be good for aging. It could accelerate aging potentially. So what you want is you want it on when you need to build muscle or repair or recover, and then you need it off or tamped down when you don't need to do that. And it appears that during old age, it gets on a little bit too much. So the idea then maybe is if we could tamp it down but then still get the stimulus with exercise, maybe it has some benefits. So as we see, maybe not. It might need a longer study. But yeah, so this is the first double-blind, randomized, placebo-controlled trial. So they had a good study design. I put a picture over here. What did I put over here? Oh yeah, so these are some of the pictures of, this is from the ITP, International Testing Protocol, I think that's what it's called. We're looking at aging in mice, and these are in mice, males versus females. So rapamycin appeared to improve function, or we could say health maybe, here in these males. And in women, it appeared to improve health and lifespan. So that's kind of why rapamycin has been studied so much. These are lifespan curves. So essentially what this is saying is the blue line is control, the red line is rapamycin. And this is when all the mice are surviving. And as this goes down, this is less mice surviving. So as this line falls, more mice are dying. What this shows is that the rapamycin kept mice longer or healthier, but it didn't change the maximum lifespan in men, but it did change the maximum lifespan in women. So there does appear to be a male-female difference here, but it also appears to improve function. So actually, let me scroll down. I have another page here just while we're talking about this. So these gray lines are the improvement in function in mice, and this is with exercise. So we can see that rapamycin and exercise are having a similar effect, at least in male mice. So, all right, we'll come back here. So that's survival curves. That's how to interpret it. That'll be important maybe here at the end of this video. So methods, they had 20 people in each group, which is pretty good. It's hard to recruit and do all this. This is kind of the layout of how they did the studies now. They did a baseline and then a post and then a follow-up, a longer-term follow-up. Actually, I wonder what that data showed. I didn't see if that improved anything. I'll look at it during this video here. So they did their initial. These are the functional tests here, the 30-second chair stand test, hand grip test, 6-minute walk test. We did all of these too. So these are pretty standard, pretty basic. And then they did a follow-up assessment and then a post one 90 days later. So 42 days and then 90 days. Sometimes with these, there is a learning effect. So if you don't do the trials right, sometimes you might want a pre-test so that they both had practice. That could have been some of the improvement, but we don't need to get into that. So they randomized, they blinded them. So, oh yeah, so now this is interesting. So this is this is their training program right here. So what they were trying to do is they took the rapamycin on day 6, as you can see right here. So this is their rest day. And so the idea was they would train, rest, rapamycin, hopefully get it clear out through the system. Somewhere in here they say they estimated about 62 hours was the half-life. So they were hoping that they had, I mean, really you have about 72 hours here. Like if you end this training, let's say at 9 a.m., to this day, let's say 9 a.m., what you're looking at is a 72-hour window there. So that's a pretty good training design. We should actually look at this. So I'm just going to show you how kind of training works. Just briefly, I'll discuss this more. Here's a poorly drawn graph. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. These are the days of the week. Okay, so let's just say the week started on Monday, so they worked out here. This over here is inflammation. So more inflammation, less inflammation. Let's call it inflam. So you exercise. If you've noticed, you get sore about 24 hours after you exercise. As you get older, that carries on. So that actually might be a study design problem that I'm noticing. So as you get older, one, it takes longer to recover, and two, your inflammatory response is less quick. So like when I was running in college, I'd get sore at about 18 hours after a really hard workout. And now, as I'm getting older, it's about 24 hours out, and that'll get to about 48 hours out. So let's just use my current. Actually, let's use somebody that's getting older. So you exercise right here. Maybe let's. Where is this at? Here we go. Okay, let's just do the exercises that they did here. So we got exercise, and we have exercise. Okay, which gives us some recovery days. Here's our inflammation. So this is what their trial did, and then I'll draw in another color what might be better. So inflammation starts to rise. And now you're getting pretty sore, right around here. And if you're a little bit older, inflammation will continue to rise, and then hopefully it'll start to recover. Well, now we got a new stimulus. So this setup that they did, it's not going to balance their training the best, because now their inflammation is going to go back up. And then now we exercise again. Now inflammation is going to go back up. Maybe we're hoping rapamycin tamps that down. Maybe. Potentially it could have that effect. And then ideally we get all the way back down for another cycle. So this is okay. But what you really want in a training cycle is you want waves to look like this. Go up and down and up and down. So now that we have this graph here, let's just draw another one. And let's look at the ideal. So in an ideal world, what you want to do is maybe you work out in the afternoon, let's say here, and then the next morning. This gives you like maybe a 12-hour window of stress, where then, let's pick a new color here. Let's go here. You get this nice window of recovery right here before it's time for another workout. Up and up. So this is kind of like a little bit more advanced, and this doesn't really work well in people's daily lives to exercise this way. But so here we have recovery, and then here we have recovery. So what we're getting here is like I don't know, it's like 50 some hours here, and here it's like at least 72. It actually might be 80 hours here of recovery. Now this is ideal. You want 48 hours of recovery. There's studies that show this. We can talk about that in a future video if people are interested. So the way they did this is they didn't really, right? We got like some recovery here. I guess even a little bit to here, you could say maybe, which I cut that off a little shorter. So you see, like, we didn't get great, I mean, you can call this recovery, I guess. They did get one big recovery window with that rapamycin. So if I was going to redesign this trial, I'm being a hater right now, but they did a really good trial. What I might actually do, because of that 60, so what I would try to do, let's just draw one more graph here. Let's show some workouts. So there is some evidence that weekend warriors still get really good benefit. So maybe I would work out on Monday and I would work out on Tuesday. Let's just see what that looks like if we draw that out. So Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. And of course this is hindsight. Hindsight's 2020. So inflammation starts rising. It rises, it rises. Let's say it's in older people. It starts to fall. As soon as it starts to fall, you're going to have to administer the rapamycin probably, especially in older adults. So let's just say here. So now we have pretty much 3.5 to 4 days. So we're looking at 36 to, 48 hours? No, math. We're looking at up to 96 hours of recovery there. And that is well below that 62 days of half-life. So you would almost need to, if I want to take a look at this, so we have a 62-hour half-life. So then you're looking at 124 hours. So we're looking at 120 for 5 days recovery. So that'd be 5 days. And now you'll have a quarter of the rapamycin left in your system. So you almost need to take it like once every 2 weeks. So if we were going to draw a 2-week plan here, let's just see what that looks like. I'm just going to simulate this. So we got week 1 and week 2. Dividing line there. Let's draw the workouts here. Let's go workout Monday, workout Tuesday. So we got, let's just say recovery starting on Friday. So we got, because you want that inflammatory response. The inflammatory response helps you recover. And so if you don't get that response, I think you're blunting the effect, which they talk about in the video. That's why they waited 24 hours after that Friday or that Thursday workout. If it was Thursday, day 6 was that day 5 workout. There we go. So here we have Friday, Saturday, Sunday. So that's when it begins. Your rapamycin, let's say on Friday. Let's draw these curves here. So we're starting to fall by Friday, Saturday. Okay. So actually, what I think would be the way to stratify this if we wanted to test this again is you would start, you'd do Rapa right here. So now we can start so we got Saturday, Sunday, Monday, Tuesday, Wednesday. There's your 5 days to get down to a quarter. Oh, we don't even need, yep. Okay. Then we would stress the system again with more exercise. It's kind of a long time. Muscle from one study I read, break down about 3 days with no stress response. They start to atrophy a little bit. So it's a little bit beyond that, but let's just say they exercised Thursday, Friday again. We have Saturday, Sunday here. Okay. So then we're chill. Exercise increases. Well, I mean, inflammation increases. Boom, and we're back down. So we can take Rapa there. It won't be fully out of the system. So if we wanted to do more rapamycin, we would have to draw another line here. Let's draw week 3. Monday, Tuesday, Wednesday. Yep. So then we would have to do Rapa. Okay, so they could take Rapa again here, theoretically. And then we would have more. So what you would get is like a very spaced out training plan, but you get these peaks and valleys. You would want more of them, but as you get older, you have to space them out more anyways. So that might be actually how I would do it. So you do it like every 10 days, right? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, maybe every 12 days, something like that, which makes sense. I've trained older people, and we moved from a week schedule to a 10-day schedule to allow for more recovery. So this might be a way that we could actually maybe see a benefit so that rapamycin isn't inhibiting protein synthesis. Okay, that was a long explanation. If you want good training, basically setting something up like this where you have your peaks and your valleys, this is what's going to optimize your adaptation. So exercise is a stress, which causes inflammation. You only get better when you recover. So don't stack your days back to back. Don't do exercises every single day. Take some days in between to recover. Okay, back to the study. It gives us the outcomes. We're going to look at this is just stats, all that stuff. We don't care. This is study design, just showing you the 2 groups. These don't matter. Okay, so this is what was talked a lot of, or these are the images, and I like images. Everybody likes images. So here we have the placebo group in black. Where are they at? Right here. Rapamycin is in orange. And chair to stand. So this is a 30 seconds. You stand all the way up, sit all the way back down, and you see how many you can do within 30 seconds. So it looks like everybody started around 13, 14 chair stands. Placebo group from 12 weeks of exercise, this is why people should be exercising, actually got up to about 20. And this is important as you get old. When you're young, it's kind of like, I can stand up from my chair. But as you get older, that becomes more difficult. And the rapamycin group got about 16. And this was statistically significantly different. So that's interesting. Here you can just see the individuals. So, I mean, you have some people who responded pretty well to rapamycin, like pretty much just as well as the and here we have a non-responder to exercise. Various reasons for that. I mean, there's lots of variables that go into these. And this is just the distribution of the chair stands. So, yeah, okay. I mean, basically what it shows is that most people, like the 50th percentile was a little bit higher in the chair stands, but on this tail you had a lot more people. And then you have, here you have that hyper responder, maybe 2 of them to the rapamycin. All right, and then chair sit to stand by week. Okay. Oh, for some reason I thought grip strength was also in there. I guess it wasn't. But this chart's sideways. I'm just turning my head to see it. I mean, I don't know how to flip this, so we're not going to flip it right now, unfortunately. They don't have I was looking for the follow-up data. I don't see the follow-up data on here. It's just week 13 stuff. All right, so this Pearl study, which is one of the major rapamycin studies in humans, and I actually took a blurb from it over here, or that I pulled AI with. They're actually looking at different things. So the Pearl study was looking at muscle mass gains in women, and they took 10 milligrams per week. And they saw an increase in muscle mass. So now muscle mass, let's write this down. Muscle mass does not equal functional strength. So in this, they measured grip strength, they measured chair stands, they measured something else. This is not muscle mass. You can get strong and have little muscle. What you're really improving there is maybe muscle mass in the functional assessments. And Dr. Brad did not measure muscle mass. It would have been really nice to get muscle mass data. They must have not had a DEXA scan. Studies are expensive, so I understand. So functional is going to be improving your nervous system. Muscle mass is going to be improving your muscle mass. So they both measure different things. But the Pearl study didn't really show, it showed muscle mass gains in women taking more than 10 milligrams. But I really think this might have been a result of that pain relief. And they were more active, which that could build muscle mass in women. So the other group did not have as strong effect, the 5 milligram group. So that's the difference there. And they say it, body composition, which is muscle mass and fat mass, and symptoms versus functional performance, they're different. So they do say that potentially in a longer duration and in sedentary settings, rapamycin might be better. I'm still holding on to this more walking thing. Probably wrong, but that's my current thought. Okay, mechanistic explanations. So this is that half-life I was talking about. So if you don't know how half-life works, it's like, let's say you have 100% of the drug in your system when you take it. After 62 hours, you have 50% of the drug in your system. After another 62 hours, you have 25% in your system. So it takes a while for these things to leave your system. So this might be where I had them take rapamycin every 12 days. So yeah, you might have to actually dose every 2 weeks and build a training plan around that. That's probably what needs to happen. If we still believe that that rapamycin could be beneficial. Safety implications, strengths and limitations. They talk about these. So it was also home-based exercise. This is hard to control. People get lazy, people lie. But when you have studies like this, people sometimes are down. And I believe they reported like a 90% compliance with exercise. So that's actually pretty good. So it seems like it was done pretty well. So here, I actually highlighted it. I had just forgotten. So future research should explore regimens to lengthen the time dose every 3 to 6 weeks. Maybe they could get away with 2 weeks, but this maybe even seems better. Yep, so that half-life. So what I was getting them down to was just down to like 25%, but then you boost back up again, right? So 3 to 6 weeks, it would really be washed out, because then if you do another 62 hours here, now you're at 13 or 12.5%, and so on. So if you gave it 3 weeks washout, you'd basically be back at 0 before you hit it again. So that's maybe a future study. It'd have to be a longer duration. These are very hard to do. So 12 months of follow-up. Okay, and then this. So this was an interesting line. Moreover, although our initial data suggests that sirolimus, rapamycin, 6 milligrams once weekly may blunt early training gains, it may plausibly flatten the long-term slope of functional decline. Now that I'm rereading this, okay, let's read this in context. Sirolimus' putative benefits on epigenetic aging, chronic inflammation, and body composition likely accrue slowly. I think that this is in question here. This body composition, I think that's in question. So these seem pretty good. Likely accrue slowly. Short-term trials, okay, so they're saying that this trial maybe wasn't long enough. These are slow changes, that's true. Moreover, although our initial data suggests that sirolimus 6 milligrams once weekly may blunt early training gains, which is what we saw, it may plausibly flatten the long-term slope of functional decline. Observing function over a full year would reveal longer interval doses, lead to net preservation of strength and endurance. So maybe I'm thinking about it may function the long-term slope. So let's just draw functional decline here. So decline is here, so lower. Functional decline. So you're young. Let's say here's 30 years old. Here's 60. So decline is like this. And then it goes like this. So if I'm interpreting this correctly, we don't want it to flatten this long-term slope. Because what we want is we want your function, if you're dying at the same time, because that's what it pretty much looks like right now with the data, is you want your function to be high, 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 and then fall off the map, right? And it's supposed to just go straight down. Let me redraw that. So what you want your function to look like throughout life is high, high, high. It's going to start to slow, but you want it to be quickly, right? Like at the end, you don't want to be around not able to walk. So this is what a brutal life looks like. Let's say if you're not exercising, you're not taking care of yourself, your decline is going to go like this, and you just can't do as much stuff here. So you could view this as like your function, this gap in here, as I showed with these gray arrows over here. And so you don't want this. This is a way harder life. You want this nice round corner. So you live well, then you die quickly. That's the best you can do for now, it appears. So what I think they're saying right here is that 6 milligrams once weekly might actually do this to your function ability. So we don't want that actually. That would be bad. I think that's what they're saying. Okay, in conclusion, sedentary adults adding once weekly rapamycin did not enhance functional performance and may attenuate training gains. There, Sarah. And remember, like, they did better than, they did improve, right? So they did better than nothing. So if we're going to name this curve right here would be just exercise. This one would be Rapa. This one would be sedentary. So rapamycin plus exercise is still better than sedentary. Okay, back to the conclusion. The regimen was associated with an increased burden, blah, blah, blah. Until such evidence emerges, regular physical activity remains the unequivocal first-line strategy for preserving and improving functional exercise. That's a good conclusion. I've kind of had some graphs here, but I think you got the idea. So, like I used to tell my students, the unfortunate fact is if you want the best life possible, you're going to have to exercise. So you don't need to exercise a lot. I'll probably make some more videos on how to do exercise, but I think this has gone long enough. Thank you for listening. Great study by Matt Kaverline and group, and Dr. Brad. I don't know these other people, but they're from New Zealand. So thank you for this trial. very beneficial. I will not be taking rapamycin at my current age and with the current data, but you make your own decisions.